Universitas Gadjah Mada, Dr. Sinta Prawitasari, and continue with the main agenda, the expert lecture, and then we close. And for the first agenda today, I would like to ask the audience who sit here in the library to stand up. We will sing together the Indonesian anthem, Indonesia Raya, followed by the hymn of Gadjah Mada. So please stand up. Please be seated. So for the next agenda is the opening speech by the Chairman of Study Program Obstetric and Gynecology Residency, Faculty of Medicine's Public Health and Nursing, Dr. Sinta Prawitasari, OBGYN, Obgynsos.
Okay, thank you. Hello everybody. Today we will to our honorable guest lecturer, Prof. Ellison Edelman, and also the representative from IPAS, Mbak Nana, and also our guests from other university. I had before that there is a representative from Duta Wacana, UKDW, and also from University of Islam Indonesia, and to our beloved residents, and also our young doctors in Gajah Mada University. Today we will have very interesting lecture by Professor Ellison about the effect of COVID-19 to our menstrual cycles in women. So because we are as doctors who will become specialists in obstetrics and gynecology, I think that this we have to really know about the effect of COVID-19 to the health of the women. So I hope that you will find this lecture is very interesting, as I hope as well. Okay, please welcome to our university. Thank you.
Thank you so much, Dr. Sinta, for the welcoming speech. And I would like to remind all of the participants who are sitting here that you can ask your questions directly to the speaker next in the discussion sessions. And also I would like to remind who joined online, maybe also can ask questions by writing down your questions on the chat box. And also we provided the Google form that has been provided in the chat, so you can also fill the presents today. And before started, let me introduce our guest speaker, Professor Dr. Ellison Edelman, MD, MPH. So she is currently a professor at Oregon Health and Science University, Portland, USA, and also associate scientist at also Center for Regenerative Medicine, Director of the Complex Family Planning Fellowship, Oregon Health and Science, University of Portland, USA, and she is also an editor at Cochrane Fertility Regulations Review Group, and she also recently published a paper at the Obstetric and Gynecology Journal with the title Associations Between Menstrual Cycles Length and Coronavirus 19 Vaccine. So it's really our honor to hear directly from her about what is the effect of especially the vaccinations of the COVID-19 to our menstrual cycles. So without overdue, please welcome Professor Ellison. Please give your applause.
Wow, thank you everybody for the very nice warm welcome. That's a lot of pressure on me for this talk today. Well, it's a pleasure to talk to you about some recent research that my team has been doing. We have 2 publications that have come out in the last year on some information that we never knew before, which is what happens with vaccine and menstrual cycles. All right. Do you guys have the slides, or do we need to put the slides up? So this is my second time in Indonesia, and actually my second time at UGM, giving you guys a talk. So thank you again for having me. The last time I was supposed to be here was in February 2020, so I was here about 4 years ago, and then was supposed to come about 2 years after that, and then, you know, everything got shut down with the pandemic. So I could have just stayed with you guys for the year, right, if I had gotten stuck here. Okay. So let's go ahead and talk about, do COVID-19 vaccines affect menstruation? Has anybody had any patients who've said that this has happened to them? Is this something that you've heard about in Indonesia? No, not at all. Well, so this is something that globally people were reporting, and because of this, the U.S. National Institutes of Health assigned special grant funding to determine this, because we were having difficulties with individuals reporting that this was happening and then having fears around getting the vaccination, because we know that when people have concerns about their menstrual cycle, then they're also going to have concerns about fertility and pregnancy and all of those things together. And if you thought a vaccine might affect your fertility, that creates a lot of fear. So, next slide. I don't think this is working. Yes? Yes? Okay. All right. I do get some money for both royalties because I write some up-to-date summaries, and then I have some institutional grant funding, and then I also am on several expert working groups, including the American College of OBGYN, which is our professional society in the US, the CDC, which is our Ministry of Health in the US, and then the World Health Organization. So when we all started having the COVID-19 vaccine, I think the US rolled out their vaccination program a little bit earlier than the rest of the world for various reasons, some good, some bad. But what started being reported in 2021, early 2021, is thousands of women began reporting that their menstrual cycles were different after COVID-19 vaccine. And so we had a lot of popular press saying, what is happening? Is this a problem with the vaccine? And why don't we know anything about vaccines and menstrual cycles? Has this been reported before? Why has nobody looked at this? And I do want to take a moment just to talk about menstruation, because I think people kind of ignore menstruation, but it's actually something that half the population does in the world, and we do it for a long time. So depending on how many children you have and how long you're breastfeeding for, actually we spend more than 10 years of our life menstruating. It's a week every single month. It's a lot of time. And what's interesting is menstruation is unique. It's unique to primates, both human and non-human primates. So monkeys and humans have cyclic menstruation. There are only 3 other mammals that menstruate. Dog. So cyclic menstruation. Not at the same time as like humans do, but we do know that dogs and cats actually menstruate, so kind of trick question. Who else menstruates? Do you guys know? That's great. That is one answer. What else? It's another really cute rodent. It is a type of mouse. Well, kind of type of mouse. Okay, so let's see here. This is really like delayed. Okay, the elephant shrew, so kind of mouse. A bat, and a spiny mouse. Aren't they cute? So these are the mammals that menstruate in a way that humans and non-human primates menstruate. So it's not very many animals that actually menstruate, and then humans and non-human primates actually menstruate in a cyclic fashion, which is really interesting. And so it's very unique to us that we see this overt menstruation that happens. And many of our patients, and actually many individuals in medicine, think that menstruation is like clockwork. Once it starts, it's like clockwork, and it should be there all the time. But we actually know that for a lot of individuals, it's not like clockwork normally for them. So their cycles are not regular. There's a lot of individuals that have regular cycles that feel like they're very regular, like clockwork. And then we have other individuals where it varies a little bit. And actually, it's okay to vary. It's normal to have variation in menstrual cycles. And we know that the variation in menstrual cycles from the Federation of International Gynecology and Obstetrics says that the variation in cycle days actually can be fairly significant. And that can still be normal and not a sign of problems. And so we have this issue of the population expecting to have periods like this, but we know as healthcare professionals that actually menstrual cycles do fluctuate a little bit. So what is normal? Well, the International Federation of Gynecology and Obstetrics says the frequency of normality is 24 to 38 days, but it can vary 2 to 20 days. That's a lot, right? Most patients would think, wow, I'm having a problem if my cycle varies 20 days. But we know, as healthcare providers, that this can be normal. And the regularity of your cycle can shift 8 days or less, and that's normal. But again, if you missed your period by 8 days, what are most patients going to think? They're going to think something's wrong, or if they're sexually active, they're going to think that maybe they're pregnant, right? Which might be a good thing or a bad thing. So that creates a lot of fear. And then the length of bleeding, normality is 8 days or less. And the volume of bleeding, we've now changed this criteria. It used to be that we said if it was over 80 milliliters, it was too heavy. But actually that's been changed because many individuals feel like, hey, my periods interfere with my life and they're heavy enough, and maybe they don't meet 80 milliliters of blood loss, but it's still heavy to me. So this criteria has been changed to what is the patient reporting, and if they think it's too heavy for them, that's considered heavy menstrual period. And really, for gynecologists, we consider this one of our 5th vital signs. And we know that it is a vital sign for individuals that menstruate because if they're not menstruating regularly, we know something's wrong. We know something may be metabolically not correct. So we know individuals that have thyroid disease, severe diabetes, eating disorders, over-exercisers. We know that they're metabolically having difficulties when their menstrual cycles are not happening. And so we really use this as a sign of health in individuals. Whether you recognize that you're using this or not, it is a sign of health in your patients, and it's something that we ask about. And patients are now recognizing that it's a sign of health. And this is why we've come to a time in the world where we have a massive vaccine rollout. We have massive recognition of individuals wanting to track their menstrual cycles and their health using electronic tracking. And so globally, we've had this kind of storm come together of people being able to see if their menstrual cycles vary more or not, and then report it as these massive vaccine campaigns have come out. So what does temporarily impact cycles? What in the scientific literature actually has been shown to change menstrual cycles? Well, pregnancy is the #1 thing that changes menstrual cycles. Well, we all knew that, right? You're like, yeah, menstrual cycles stop when you're pregnant. We know that catastrophic life events like war can affect or disturb menstrual cycles. So the stress of being in a stressful external environment can cause changes in menstrual cycles. Excessive exercise. Again, if somebody is metabolically deficient, we can see this happen. And actually, for professional athletes, if their menstrual cycles stop or they get amenorrhea from exercise, we know that they're already metabolically deficient. We're already behind in getting them to the right place because once their menstrual cycles stop, actually their performance goes down. Large fluctuations in weight, either high or low change menstrual cycles, disordered eating and famine. Acute illness changes menstrual cycles. So when we have vaccines rolling out, and then also a disease happening, it's really hard to see, is this due to the vaccine or is it due to something else? Medical comorbidities, we already talked about thyroid disease, diabetes, things like that. Medications sometimes can disturb menstrual cycles too. And these are population level studies that show this, but I'm sure you all know, or you've experienced this yourself, that some people are just a little more sensitive to menstrual cycle disturbances. Like maybe you traveled and your menstrual cycle became a little bit off. Or maybe you had a really important tests that you were taking, and all of a sudden your menstrual cycle is off. So we know that there are individuals that are slightly sensitive to disturbances that aren't at this level, but it's hard to study that at a population level. That individual knows it for them, but they don't know it, we don't actually see it in a population level that an exam test in medical school causes your menstrual cycle to get off, right? So we don't see that in a population level, but we know from reproductive infertility studies that some people are stress sensitive and some people are stress resistant. So what about, does the pandemic stress impact menstrual cycles? Pandemic stress has been real, right? Have you guys, I mean, almost everybody's had some pandemic stress, right? Yeah. So does pandemic stress impact menstrual cycles? And the interesting thing is pandemic stress has been really different for everybody. Some people are very anxious. Some people, it's been their best life. They've learned how to bake bread. They've become gardeners. They get to work at home. Where some of us, I actually worked more during the pandemic. And we had to quarantine my husband, who's a pulmonary critical care specialist, in the basement for 3 months. You know, so everybody's experienced a different level of stress. And what's interesting is we didn't know, does pandemic stress impact cycles? So is this something else that is adding to people saying that the vaccine is causing their menstrual cycles to change? And we had a nice study come out that actually showed at a population level, pandemic stress does not impact menstrual cycles. So we're like, okay, well that's one confounder that we can put over here that's not maybe causing a population to change their menstrual cycles. Maybe for an individual who had a lot of stress, maybe their cycles changed, but at a population level, no. And what about other vaccines? Why haven't we heard about this before? Well, we haven't had this massive of a vaccine rollout globally in years, right? Maybe the last one was, I don't know, smallpox, polio maybe? But people didn't know that menstrual cycles were important to them. They couldn't track digitally, right? So somebody might say, oh, I had a menstrual cycle change, and people were just like, no, that didn't happen. So we do have a couple of signals in the literature over the last 40 or 50 years that maybe vaccines do cause a menstrual cycle change. We have reports from rubella vaccinations in the 70s where individuals who menstruate said, I think my menstrual cycles are different. And they said, no, that can't be. And then in the 2000s, there was a massive HPV vaccine in Japan. And individuals reported menstrual cycle changes. They also reported a constellation of other symptoms. And when they looked into it, they said, you know what? This was a public hysteria. So it's just, this went viral, everybody reported it, and we can and have determined that 22 of these symptoms were all mass hysteria. The two that they couldn't totally rule out were things that had to do with menstrual cycle disturbance. But they said, you know what? Most of these individuals are younger women. They have menstrual cycle disturbances anyway. So we're just going to ignore this. So we have had signals before the COVID vaccine that maybe other vaccines do slightly disturb the menstrual cycle. And then also in some of those vaccine studies, it may be that your state of estrogen affects how you react to the vaccine. We know that high estrogen states, so reproductive age individuals, actually change their immune response. We know that women do better than men when they get COVID. That's kind of nice, huh? So we know that there's something happening with estrogen exposure. We also know that postmenopausal women kind of acted like men, so lower estrogen rates. So it may be, and we know that the hormone track talks to the immune system. So we know all of these things, and it may be that when you get your vaccination, you have a different response if it's in the luteal or the follicular phase. So this is, at this point, just a hypothesis, but it may be that we respond to vaccines differently if you're in the luteal or follicular phase. Or you may also have more symptoms if you're in one phase or the other, which sometimes also means that you had a better or worse response to your vaccine. So we have all of these interesting things in individuals who menstruate that we haven't studied before. All right, so one of the things that I talked about before, and maybe you all have a system too, but in the United States, I think nobody knew about our reporting system for vaccines until the COVID-19 vaccine. We've had a reporting system for vaccines forever, but we were really encouraged as a community, as a society, as a nation, to report our experience with this vaccine because it was new. And a lot of people did. And we saw a lot of reports of individuals having menstrual cycle disturbances, but it wasn't very many reports. So out of 100 million vaccinated, we only had 2,000 reports. Well, one of the things that happens with reporting systems are they ask for the common things like, did you have a fever? Were you achy? Did your arm hurt? Did you have an allergic reaction? They don't ask about menstrual cycle changes. But people could free comment, and that's how many people chose to free comment, which is a lot in a system that's not collecting this information. And then also what happened is many, many people started reporting in social media, which is something new that we have now in a vaccine rollout. And then the UK also had this situation too as well, where they had over 48 million vaccinated women, but they had 37,000 reports of menstrual disorders. And they were like, well, we've looked at things and we don't see a link. But they aren't also capturing it in an active way to be able to tell if there's a link. We can only see in these passive reporting systems that there might be a signal. So these passive reporting systems are great for rapidly detecting a signal if people are using it. And it's possible to detect rare events. So maybe this is just a rare event. But it doesn't have a control group, so you can't assess causality. And we know that we're talking about something that varies anyway. So is it just people are paying attention because they're at home and they're tracking their menstrual cycle and they don't have something more to do during the pandemic? And did they just not understand that they have cycle variability anyway? And is it related to the vaccine or not related to the vaccine? So really, one of the problems that we've had in the United States and in a lot of other countries, although it doesn't sound like it's as big of an issue in Indonesia, is that we have a lot of personal experience with menstruation and ideas about menstruation that it should be right on time. And then we also know that individuals now know that it's an important part of health. We think it's an important part of health to have menstrual cycle regularity. But there's also a lot of myths and misinformation around it too. Like if you skip one menstrual period, maybe you're infertile. We all know that that's not the case. So we actually were funded by a special grant in the U.S. National Institutes of Health. So we were funded in we actually applied in May 2020. We received our funding this is funny about the NIH. So we received notification that we got the grant in August 2021. But then they say, oh, your research started a month ago. So we started doing these analyses, and in just a year, we were able to publish 2 reports, which is pretty fast for research, given that we have millions of data points to go through for menstrual cycle tracking because it's daily tracking from individuals. And so we've just recently, actually just 2 weeks ago, released our global paper, and then we have another one in peer review looking at menstrual flow. So what did we look at? We wanted to determine if COVID-19 vaccine is associated with menstrual cycle changes, like length, regularity, duration, and then volume. So that's what our goal was. And our goal was to really see, does this happen? Is it causal? Because we needed a control group to compare. So we did a retrospective analysis of prospectively tracked menstrual cycle data. So individuals have been tracking their menstrual cycles because they wanted to in these fertility applications. And then we were given access to anonymized data to be able to analyze it. And we surveyed them to say, did you get vaccine? When did you get vaccine? What type of vaccine did you get? Or did you not get vaccine? And we initially came out with our US-based population because our grant funding was from the United States, and they really wanted to see, is it our vaccines that are doing this, the mRNA vaccines? We only included reproductive age individuals. They had to be naturally cycling. They had to have a normal cycle before their vaccination. And if unvaccinated, we had to have similar cycles. And we use these two companies. Most of our data so far has been from Natural Cycles, who individuals only use this app if they're pregnancy planning or they're using it for fertility awareness contraception. We are going to be coming out with some data with Clue later this year. And our initial study looked at about 5,000 individuals from the United States, 2,400 that had reported vaccination, and about 1,500 who had not. And what's interesting for us in the US is just who got what vaccine, which you can see here, the majority of individuals got Pfizer vaccination, and then the remainder had Moderna, which those are both mRNA vaccines. And then as well, we have a population in these users that's mostly white, which the United States really likes to know the race and ethnicity of the studies that we're reporting on because of the distribution in the United States and how differences may occur within different populations. And you can see that we had a fairly young population in their 30s. And this is just our visual abstract, just to illustrate this a little bit better, but what we were looking at is, does the COVID-19 vaccine, as compared to a control group who did not get vaccine, cause menstrual length changes? And we saw a small increase, so the calendar up above. If you got one shot in a cycle, they had less than 1 day change in their cycle length. So not very much. But for an individual that is expecting a normal cycle and they just got something that's controversial, that may seem very scary. And then for individuals who got 2 of their vaccines, because remember the initial vaccine, you got 2 in a month, if those both occurred in one cycle, they saw about almost a 2 to 3 day increase in their cycle length, so a little bit more. We saw no changes in the number of days that you bleed. So your menstrual bleeding itself, the number of days did not change. And so what we found from this was a first study using prospectively collected data that could show a causal link to vaccine. So we know that there were fluctuations of menstrual cycles in both the vaccinated and unvaccinated group. However, even with that, we saw that those who received a vaccine in a cycle had less than 1 day increase, and those that received 2 had a 2 to 3 day increase. The menses length did not change. So then we were like, well, we need to look at the global data. You know, the US likes to think of themselves as the only country, but there are many more countries and many more vaccines available, and we wanted to see, you know, what's happening with the rest of the world. So we looked at the global data, and we had almost 15,000 individuals who had received a COVID-19 vaccine, and about 5,000 individuals who did not. And we did the same thing. We looked at what was happening with the cycle length. And what's interesting here is you'll see that the majority of individuals are either from the UK, Europe, or US, and we have a few folks from this side of the world, but not many. So it may be that individuals in Indonesia or in Asia use other menstrual trackers other than Natural Cycles and Clue, or maybe it's not as popular to track menstrual cycles in this part of the world. You'll have to tell me. But you can see here that we had a lot of different types of vaccines. The majority of the vaccines, again, were vaccines received in the UK, Europe, or the United States. So mostly we have Oxford, AstraZeneca, we have and then we also have Pfizer and Moderna. And then really, you can see for like Sinovac, where you all had Sinovac here, we only have 60 users that use Sinovac, so not very many. So we don't have as much information about that vaccine. And this is our visual summary here as well. And so again, we looked at these individuals, we looked at their cycle changes, and you can see that there's just a slight shift, If you got 1 dose in a cycle, it's just a slight shift, less than 1 day. If you got 2 doses, we actually saw a little bit more of a shift. And in days, it's about 3 to 4 days of shift in cycle. And then we looked at after vaccination. So we now had enough data past vaccine campaigns to look at post-vaccines to say, does this get back to normal pretty quickly? And you can see here that this histogram, it's basically back to normal. And this is the cycle after your 2 doses of vaccine. So it gets back to normal pretty quickly. And again, we saw no changes in the number of days of menstrual bleeding. And then we looked at different types of vaccine because people were really worried about the mRNA vaccine, even though it had great scientific data around it, but there was a lot of misinformation saying, is this dangerous? It's different than our other vaccines. So we looked at mRNA vaccine versus all the adenovirus vaccine versus all the inactivated virus vaccine. And this is for the first dose and second dose. And you can see the overlapping standard deviations. And there's no difference in how these affect the cycle length. It looks very similar, which is very reassuring that the mRNA vaccine works very similarly to other vaccines in terms of this side effect. So what do we know after this global cohort? Well, this study again was designed to determine causation. We again see that individuals have fluctuations in their menstrual cycles, whether they get vaccinated or not. But it does look like those who get vaccine have a less than 1 day increase in their menstrual cycle. That's at a population level. That's a mean. So some people don't see anything. Some people see a little bit more. And then among those who are vaccinated with 2 in a cycle, they saw a 4-day increase. And then we see that it's getting back to normal after vaccination. So we still have so much data to go through. And what's been interesting about working with the digital applications is you don't have to put in information it's not mandatory to put information in that's not about your cycle length. So if you want to put information about how much you're bleeding or the symptoms with your bleeding, that's not mandatory. You can choose to put that information in, but you don't have to. So it's been interesting to identify users of the data to be able to look at other things like menstrual flow. Does vaccine make your periods heavier? It's been harder to look at that because it's not a mandatory variable that patients have to enter. So what do we know? Menstrual health is important to people. It's important to us as gynecologists. Menstrual cycles vary normally without vaccine. Menstruation and vaccines are completely understudied. And there's a big delay with this. Let me see if I can get it in the right place. The public helped drive this impactful research. So the public had a question about this, and we wouldn't have this research without them. And then again, we probably have more questions now than we did before, but at least we have some information that it does slightly change the cycle length. And then we're able to kind of move forward on some other research questions now. So, research doesn't take place without a village. This is my village for this research, and all of these people and the funding help support it. And that's why we now have information about vaccines and cycle length today. So I'll end there and open it for questions. Yeah?
Yes, sure.
Okay.
So please give the big Applause to our professor, Professor Ellison. Thank you so much. So I think from this lecture, we learned a lot about even the normal menstruations and what the situations that make the menstruation cycle itself changes. So I would like to invite of the young doctor and also residents to ask any questions regarding our topic today. So please, you can raise your hand. Who will ask? So before, maybe they will ask later, so I would like to ask about, so you said that there is no differences, right, between the type of the vaccines, messenger RNA or adenovirus or inactive virus. But how about the differences across of the certain range of the age? Is there any differences?
The age of the patient?
Yeah.
Yeah, so you can see that most of our patients are kind of centered around like 20s and 30s.
Reproductive age.
Reproductive age, although we don't have individuals in their adolescence and young, and so we can't say for sure if there's not more variability for that group, but they have more variability in their cycles. So it's another question because we just don't have them. Everybody had to be 18 or older to be included in this cohort, so we don't have younger individuals in it, which, you know, it may be that they're more sensitive to disturbances, which they probably are. We see that with other things impacting their menstrual cycles. They're a little bit more sensitive because their hypothalamic pituitary axis hasn't matured yet. Yeah.
Okay, and then another thing is about the range of the age, and then the conditions, the pandemic situations. This is one of maybe the confounding factors, right? So how you deal with these confounding factors?
Yeah, that's a limitation of the study in that we don't know people's individual stress levels because we're using data, and it's not a mandatory variable for them to report what their anxiety or their stress levels were. However, we feel that because we have this control group who is also undergoing the pandemic at the same time, that helps decrease the variability or the confounding.
Yeah. I'm curious about the controls. So at that time, when you give the vaccinations, it not in the same time or what? I mean, like how we can get the people that maybe, this is the range, it's quite maybe 3 months, 4 months. Usually we will give the vaccinations in the same durations in Indonesia. Maybe a couple months is in the same duration. But how we can get the people that not vaccinated and vaccinated?
Yeah, that's a great question. So a lot of that has to do with the cultural acceptance of vaccines.
Yeah.
So the United
still
States
in the U.S. also
So there are a lot of individuals outside of in different countries that have the autonomy and rights to refuse vaccine and feel very strongly about that. And so that's likely most of the individuals, they were either waiting to kind of see how vaccine was going to go, how other people did. And then
what is the effect?
Yeah, what is the effect? So we have some people who are just like, I'm going to see what happens. We have other people who maybe didn't get their vaccine yet over the same amount of time. And then we have a lot of individuals who are like, I'm not getting the vaccine. So that's how we were able to get this control group. What's harder now, so this data was pulled early in the pandemic as the vaccine rollout was happening. What's harder now is we also have the confounder that almost everybody has had COVID.
I see. Yeah.
Whereas before, not everybody had COVID.
So you also included the people who suffer COVID for the control or not?
So we don't know if they had COVID or not.
Oh, I see. Because this is the secondary data, right, from the applications.
Correct. Yeah. And also this is early enough before the Omicron and the Delta waves. So this was all kind of earlier. So this is all from January 2021 to about September or October 2020. Yeah. So it's, you know, this is really fast moving research and how it affects as you go along. So now we have the confounder of almost everybody's had COVID and vaccination and COVID another time, right? So we have a totally different population, and we don't have great data yet about how much COVID disease affects menstrual cycles. We know in general, infectious disease, when you have a serious infectious disease with high fevers, that your menstrual cycle can have disturbances, but we don't specifically know about COVID yet and how it affects menstrual cycles.
Yeah, thank you. So I will remind all the people here who's sitting here, is there any questions? Oh, okay. Can you mention your name? Mention your name.
Thank you, Prof, for the great presentation. I'm Inga Nandia from first semester of OBGYN resident. I would like to ask, could you explain, is there any difference between after COVID-19 vaccine and after COVID-19 infection to affect the menstrual cycle? If there are any differences, what makes happen? Thank you, Prof.
Yeah, so that's a great question. We don't know yet if COVID disease impacts the cycle as much as the vaccine or more. So right now we don't have that information yet. We're analyzing some data from the KULIAH data set that we have that we hope, we're working with a French researcher who also had this question, so we're hoping to have that information soon. I would anticipate that it makes similar changes or more changes. Maybe more changes if you had more severe disease, but we don't know that yet.
Yeah, I think it's still big questions, right, about the pathophysiology related to what is the effect of the vaccination itself to our menstrual cycles or the infections of COVID-19 to our menstrual cycles. I think still big questions about the pathophysiology as well,
Yeah.
right? Yeah.
Although we have very good data now showing that, initially when this was being reported by the public, people were really worried. What does this mean for my future fertility? And now we can really see with all of the research that has come out that menstrual cycles are changed just a little bit. They get back to normal right away. It does not impact individuals trying to get pregnant or doing infertility treatments, and it doesn't impact pregnancy. In fact, it improves pregnancy outcomes. So now we have this long pathway along all the fertility showing the vaccine itself is very safe, which I think many of us who are supporters of vaccine and know that there's great data around vaccine know that to be true. But with this new vaccine, there was just so much fear. Is this different? Is it not different? What's happening? And we don't have the data. So we need to get the data to be able to help know what is happening. How can we let individuals know so women can know, oh, I might have a fever. My menstrual cycle might be off a couple days. That's okay. So, and before, if you didn't know that, you could be really worried.
Yeah, I think maybe we ever hear about the long COVID. Yeah, right. So the symptoms still exist, even like we already, there is no active virus in ourselves, but still having something, like easy to fatigue or something like that. So maybe it's also a very good idea to learn about infertility effect of the COVID infections to our reproductive health.
Yeah,
maybe,
and long COVID is
yeah.
incredibly interesting. Patients also report disturbances of menstrual cycles during long COVID, but again, that hasn't been officially looked at. So because we know that menstrual cycles vary anyway, it's very hard without prospective data to say, are they just varying because they're varying, or are they varying due to an exposure? And so it'll be interesting to see if long COVID may affect things for longer. Yeah.
Okay, I would like invite another people, maybe would like to ask from the young doctor. Okay.
Hello, Professor. I'm Farah from Young Doctor. Maybe I want to question about how does the vaccine works toward our menstrual cycle? Does it have specific effects on its path or one of the paths? Thank you, Doctor.
Yeah, so, this study, interesting because now people are like, well, why does this happen? And we're like, we didn't even know it happened. So now we know it happens. And now the question, the very good question is, why does it happen? And this research does not answer that question. We do know from prior research that the hypothalamic pituitary axis, which is your body clock that runs menstruation, talks to the immune system. So it probably has something to do with that, but we don't know for sure. So now that we know it does happen, now it's why is it happening? So those are kind of the next steps. And also, does it happen differently in different patient groups, like younger patients or patients with gynecological inflammatory conditions like endometriosis? Does something different happen for them? And this data, we don't know yet because we had to exclude patients because we needed to see, is this happening? So we needed a group of individuals that had regular cycles before the vaccine to see if something was happening due to the vaccine.
Even also like BMI, obese people and not obese people, maybe also change the cycle as well. So is there any questions from the online? Can we see any questions from the online participant? Not yet? So please, from senior residents, I would like to invite any questions. I think
They're all very tired from night duty. Yeah.
So you would like to ask any questions?
Or you can ask a question that's not related to the research. So if you have questions about medical training during the pandemic in the US or
Yeah, Dr. Kuki will ask questions. So
you would like to,
please-
Dr. Sinta would like to ask that question.
Dr. Sinta?
If it's allowed to ask outside your research, I would really want to know about the residency education during pandemic in your country or in your hospital.
Yeah, so when the pandemic happened, and for the United States that happened, really it was being recognized through January, February, March of 2020, but really states started closing down in March 2020. But different states did different things. My state was very early in closing down, as were all the states on the western side of the United States. So Washington State, Oregon State, and California all closed down pretty early. And for education, what happened is all medical students, everything in education stopped. So everything stopped, and then they started having virtual lectures, which luckily in our institution had already started happening. They do a lot of flipped classroom activities. Does that translate here, flipped classroom? So they do pre-work, they might watch videos online, and then they come to the classroom to get more training. So that had already been happening at our institution because of curriculum development and innovations. So they switched everything to online, but they could do none of their clinical training. And that didn't happen. They weren't allowed back to patient care until about 6 months ago. So 6 months ago is when medical students were allowed back into care. For residency individuals, it depended on the residency programs. At our institution, we, all of us, faculty and residents, changed how we covered things. So instead of residents being on one rotation for 6 weeks and then switching to a different rotation, everybody, all the ambulatory care services or outpatient services were shut down, and only hospital services were maintained, at least for a couple months. And so everybody was shifted to rotations for the hospital. So we would do 2 weeks on and then 2 weeks off, so that if you got COVID, you could come back after your 2 weeks. So that's what happened early in the pandemic. And then after about 3 months, we realized because we shut down so quickly in our state was not overwhelmed. And actually, we ended up being kind of bored. because we had shut all these activities down, and so we started increasing them again. However, the support staff were still at home, so it was much harder to do things because we didn't have the same support staff available. So.
How about the current situations? Is already back to the normal situations, or still online or online meeting, or?
Yeah, so I think a lot more things are online than they were, but things are back to the normal training. So we have medical students in with us with clinical care. We have residents. Our ambulatory services are back up. What I would say is different is that the population now, so coming to Indonesia was very nice because you still have a mask mandate.
Yeah.
In the United States, we only have mask mandates for hospital settings and clinical settings. So I wear a mask all day at work, but nobody else wears a mask. So if you're in a hospital or clinical setting, we're all wearing masks. But if you're out and around, it's your choice. I would say my state, again, because we've been public health oriented, there are a lot of individuals who, if they go in a grocery store or a populated place, they'll put on a mask, but then outside they won't put on a mask. So it's different. And airplanes in the United States, not required now. So you might get on an airplane, and like when I came to Seattle, from Portland to Seattle, I was the only one wearing a mask on the airplane, which is an interesting thing for peer pressure, right? But so it's a little bit different now. We still have a lot of capacity issues. So the workforce has really changed in the United States, and that has made it difficult. So again, you might have the doctors and nurses, but you don't have all the support staff at the level that we did before. So that's made it challenging. So wait times, which people in the United States do not like to wait for health care because they pay for health care, so they expect to get it when they want it. So it makes it difficult because they're having to wait because we have capacity issues, which is new for the United States, at least in metropolitan areas. In rural areas, it's always been challenging, and it continues to be challenging.
COVID situations change in every sector, right? Okay, one more questions. Is there any questions from?
It's okay, you don't have to have any questions.
Thank you, Prof. My name is Kuki. I'm from fourth semester. I want to ask, may I ask about your study? What is the reason why you put AstraZeneca vaccine as exclusion criteria in your research? Thank you.
Why did I include it as a?
Why you exclude AstraZeneca vaccine from your research? Prof?
Yes, so AstraZeneca, because we have the UK, a large number of individuals had AstraZeneca vaccine, and it didn't seem to act any differently than the other vaccines. I think that was your question, but that's why we included it, yeah.
Okay. Yeah, so is there any questions? I think all people satisfied, right, with the presentations today. And we give the big applause to the Professor Ellison. Thank you so much for the very nice presentations. It's very useful for us to understand about the normal menstruations and also what is the effect of the vaccination itself to the menstrual cycles. So now I would like to invite Dr. Sinta to give the special gift from our faculty and also from our department. Yeah.
Well, and I just want to thank everybody for your attention. It's a pleasure to be here again.
Sure, it's also our honor to have you here.
You guys are all like, what is it? Oh, like a table? Oh, beautiful. Wow. I'll definitely come back to Indonesia.
Yeah. Thank you so much, Elizan. It's really, really nice to have Anison today.
Maybe we can take picture with the
Sure, sure, sure.
You sit here and
Yes.
take the picture.
Oh, yeah. Can we take picture from here and then we can sit here? Elizan, please sit here. I think this is the very important part of our discussion today. Yeah, sure. Dr. Agung, can you please sit here, Dr. Agung? Yeah. Oh, you know, today is very special day because every Thursday paying ya. Yeah. We will wear the specials. Mm-hmm.
I'm glad I came on the day that you're wearing traditional dress. It's really nice.
Monggo, Dr. Agung. Kelihatan semua nggak, Mbak? Yeah, please give your big applause. I think I would like to thanks to everyone who come here to participate of this event. And tomorrow we will still have another lecture from the Jinsos ya. Sama besok. Yeah, tomorrow. And thank you so much. And hopefully you can enjoy your day today. And thank you so much for Professor Elizan to come to UGM. Maybe next time you can come again to our faculty and then maybe another paperwork you will present. Yeah, we're waiting for. Okay, thank you so much. Bye-bye.